where the fund will invest include building a strong and resilient health workforce in these countries, strengthening disease surveillance, laboratories, community engagement, emergency coordination and management, as well as investments in vaccine therapeutics, diagnostics, and other critical medical countermeasures so as to prevent the kind of situation we saw in COVID-19, which was that it was very hard for poorer countries of the world to access affordable vaccines and other medical countermeasures. And some of the key principles on which this fund will be based is complementarity between with the work of existing institutions, including multilateral development banks, the WHO, UN agencies, Global Fund, Gavi, Sept. This fund will channel resources through all of these existing mechanisms. It is not meant to be a new institution. It is intended to promote coordination and to serve as an integrator rather than creating yet another silo. We also will ensure that every dollar of grant financing that this fund provides incentivizes countries to invest their own resources in pandemic prevention, preparedness, and response. It has been designed with inclusivity and agility, with an equal representation of donor countries and potential recipient governments on the fund's board. It includes civil society voice as voting members, and we hope that it will serve as a platform for advocacy going forward. And it will operate with the highest standards of transparency and accountability. So the fund will issue its first call for proposals around November. It will be designed in a way, the call for proposals will be designed in a way that it really does attract country-led, country-driven ideas and proposals for funding, and that every proposal helps strengthen country-level national plans on health security and promotes coordination amongst all the partners that are working at the country level. So we're very much looking forward to working with all of you and supporting your efforts and initiatives in strengthening pandemic prevention, preparedness, and response. And we will be in touch with you. We already are in touch with many of you, and we will be in touch with you as we issue the call for proposals. And hopefully, this fund, it's one part of the solution, but we hope that it will help build that momentum for strengthened pandemic prevention, preparedness, and response. Thank you very much for your attention.
Thank you, Priya, for that great remark. So at this junction, I would like to invite Professor Maha El-Rabah, former Minister of Health of Egypt and member of the AU COVID-19 Commission, to deliver a remark. Prof, the mic is yours.
Thank you very much, and thank you for this opportunity. So, Excellencies, distinguished guests, participants, ladies and gentlemen, briefly, I'm going to go through the new compact for health workforce development in Africa. But before speaking about it, I would like to tell you, or to just think about the challenging situation of the continent. So the health needs across the African countries, they have and they will continue to evolve over the years. So changing, increasing the demand on the health services, aging population, youth booms, double burden of disease, higher mortalities among women and among children, among other vulnerabilities, the emergencies, the climate change, all of those challenges or all of those dynamic changes will require a new oversight about the blocks of the resilience of health systems and of the needs for the health workforce together. So Africa has a chronic shortage, and this has been mentioned, and I don't want to go through it again, but it is compounded as well, not only with the shortage of health workforce, but it's compounded by the gaps in the service delivery and the service coverage, with the inadequate skill mix, inadequate training, underinvestment in the health sector. So the health workforce poses a challenge that hampers health systems strengthening and resilience and people-centered approaches for the achievements of the universal health coverage. So we always talk about the health workforce in terms of the availability, the accessibility, acceptability, and quality, but there are other difficulties as well. that really hampers all of those factors that are needed for a well-functioning health workforce. We have difficulties not only in the numbers, but as well with varying degrees, with education, the training, employment, deployment, the succession plans, and as well, most of what is happening is not really responsive to the people's needs for the health and in the financing. So the African Union COVID-19 Commission, which is headed by His Excellency President Ramaphosa, in his role as the AU COVID-19 champion, has prioritized the health workforce agenda in line with the new public health order by securing a mandate to establish the AU Health Workforce Task Team to support the implementation of the Africa CDC framework for development. And this is going to be done through a compact, a social compact that is fostered amongst the member states to frame a pathway that really ensures the adequate and capable development of health workforce to satisfy the health needs of the people. What is needed is for the achievement of health, for the achievement of the universal health coverage. And this pathway will harmonize governments together and partners' actions towards a common vision, ensuring dynamic, sustainable actions, resource and finance with metrics and with measurements for the fairness, equity, quality, and universal health coverage. So the compact should bring together the governments, the businesses, academia, the labor forces, the civil society to address all the structural deficiencies, but at the same time to hold, there is a form of accountability that is held to the outcomes that should be reached. So saying this, the compact serves as an evidence-based operational framework and as basis for continuous tracking within the principles of inclusiveness and recovery, defining goals, setting the targets, and outlining the member states' peer support mechanisms and innovative modalities to collectively grow the health workforce. What we really need to understand is that whatever is being done, it has to be contextualized according to the different situations, the different systems of the countries. So contextualization is important as well. And the functionality of all the actions and all of the frameworks that are going to be developed and the tools, and what we aim for is this sustainability. So the task force as well, with what is happening with the compact, will mobilize the needed resources to provide and to bridge the support to member states to support them as they grow their fiscal space. So in a way, it's like a bridging step for future actions that needs to be undertaken. On a second level, on our second front, but complementary for the AU, for the compact and for the health workforce task team, the African Union secured as well a mandate to establish the Alliance for Health System Strengthening. And this is really important to support member states as they build forward better. So we always say now this is the time, the opportune time, the window of opportunity. We need to look forward how to build better. And in a way, the health system strengthening involves securing, monitoring the sustained financing required to retain the health workforce and the capacity building. So saying this, and I don't want